by UNESCO ICBA, the Knowledge and Innovation Hub for Africa 19 countries, that is the KIX Africa 19 Hub, and also working together with the UNESCO Regional Office for Southern Africa, and that is the O3 program. The O3 program stands for Our Rights, Our Lives, and Our Future. And we want to welcome all of you that have registered to join us for this webinar. I can see colleagues from all parts of the continent. You are welcome, friends. The theme for the webinar is on mental health and psychosocial support for teachers. And we want to see if this is the great investment for our teachers in Africa. We want to discuss the various approaches that have been at the forefront to try and strengthen mental health and psychosocial support for teachers in Africa so that we can have a resilient working force in Africa. I'm kindly requesting once again, colleagues who have not muted their microphones, please mute that microphone. Elizabeth, kindly mute the microphone. We have a good lineup of speakers that have been presented to us today that will be speaking to us. But in a special way, I want to also thank Dr. Christian, who has agreed to be our keynote speaker for today. Dr. Christian, you're very, very welcome. We also have online our director for UNESCO, ICBA, who is present online. And we have quite a number of colleagues from Eswatini, from Uganda, from Ethiopia, as well as Southern Africa and ICBA that will be speaking to us. And without much ado, allow me to hand over to our director for UNESCO ICBA, Dr. Wooden Quinton, to give his welcome remarks. Over to you, Dr. Wooden Quinton.
Thank you, Victoria. I hope that you can see me. We are very, very happy to have this webinar today. As many of you know, the webinar is organized under the KIX Africa 19 program, that is a knowledge and innovation exchange, and thanks to the Global Partnership to Education and IDRC for the funding to make KIX feasible. This is actually part of a series of webinars that we are starting a little bit ahead of Teacher Day, which, as many of you know, is on October 5. We will have 3 webinars before October 5 today on mental health and psychosocial support for teachers, and then 2 others on teachers in situation of emergencies, and then on teacher motivation. We also plan to have the KIX Symposium in Abidjan, and maybe we can mention that towards the end of the seminar, as well as events we will organize with other UNESCO offices on Teacher Day itself. And I just want to mention that after Teacher Day, we'll continue with another series of 3 webinars on school leadership. The first one will be about the importance of having more female leaders. The second one about an initiative to create an Africa Center for School Leadership, and the third one on the professionalization of the teaching profession. Now, as some of you might know, we have had quite a few trainings led by Victoria and her team on mental health and psychosocial support for teachers in multiple countries over the last few months. We also have a research program at ICBA on some of those issues. And I just want to take 2 minutes to share a few highlights. The first is that we are all aware of the context of very high learning poverty in Africa, with 9 children not being able to read and understand a simple text by age 10. Better teaching is key, but we have a major shortage of qualified teachers, and UNESCO will release in a few months its first global report on teachers on that topic. We need to make the profession of teaching more attractive. That's an issue about teacher salaries and benefits, and we are doing work in a dozen countries on measuring those. But it's also broader. As some of you may know, many teachers have low satisfaction in their job, and there's a very high level of burnout among teachers. We believe that providing better professional development, clarifying career path, including initiatives such as teacher awards to recognize teacher, and the focus of today, providing mental health and psychosocial support to teachers and to learners is really essential to improve job satisfaction and to ensure that teachers get the services they need. I just want to close by thanking the program also O3, which is Our Rights, Our Lives, Our Futures, which actually helped us doing some of the analytical work that IGBA has done in this area. We are very interested in collaborations with many of you in promoting both analysis and policy dialogue, as well as training for teachers in those areas. So without further ado, Victoria, back to you, and thank you again for putting this series of webinars together.
Thank you so much, Dr. Wooden Quinton, and we really appreciate those welcome remarks and the re-emphasis on the subject for today, that mental health and psychosocial support are very, very essential to improve the motivation of our teachers in Africa. Our colleagues and friends, for those that have just joined, you are very welcome. I'll just want to remind you that in case you are not speaking, kindly switch off your video and mute your microphone so that we have only the speaker that is seen. We really love to see your faces, but because of the bandwidth issue, we are requesting that you switch off your videos to allow everybody to stay online. Thank you very, very much for your understanding. And I also want to announce that we're going to be using the chat room for introductions. We want to know you, where you're coming from. Kindly use the chat room to type your name, designation, institution that you work with, and which country that you are working or you are dialing in from, so that we get to know who you are. I'll be having my colleague Yvonne Mboya Rispa, who will be managing that chat room. And in case any comments come up, feel free to type them in the chat room and we shall pick those comments. In the interest of time, I would like to, I know that Dr. Christian Adai Poku, he's online and he's our keynote speaker, and he's going to be talking about prioritizing teachers' well-being and psychosocial support for better learning outcomes in Africa. And the question is, who is responsible? Dr. Christian is the Secretary General for AFTRA. He's also the Chief of the National Teaching Council of Ghana, as well as the President of Education International for the Africa region. So I am hoping that Dr. Christian, you're able to hear me and you can connect now to give your keynote speech. Over to you. Thank you. Dr. Christian, we want to hear from you. Kindly unmute yourself.
Hello. I'm Philippine Sapundi from Kenya.
Please, can you hear me?
Yes, we can hear you, Dr. Christian. Please go ahead. Thank you very much.
Thank you very much. My apologies for the challenges with my audio system. Greetings to all participants at this webinar under the theme, Mental Health, the Best Investment for Teachers in Africa, a systematic approach to strengthen mental health and psychosocial support for resilient teachers and learners in Africa. Coming from the background of a classroom teacher, a teacher unionist, and presently a regulator of teachers, I feel quite honored to be invited to deliver the keynote address at this program. Growing up in a typical Ghanaian village, our only conception of a mental health patient was someone naked or in tattered clothes, sometimes violent, soliloquizing, and usually homeless. Today, I hear kids in Ghana talk about how they are stressed, traumatized, or depressed. Such is the level of awareness about mental health, or how pervasive mental health has become in our world today. As our world becomes more sophisticated and people are pressured to survive in this complex world, as we tend to ignore the triggers of mental health associated with our daily routines. Today, the plank of my presentation is on mental well-being of teachers in Africa under the theme, prioritizing teachers' well-being and psychosocial support for better learning outcomes in Africa. Who is responsible? Mental health is generally seen as a state of well-being in which the individual realizes their own abilities, can cope with normal stresses of life, can work productively, and is able to contribute to their community. This is very critical if we can get the best output from any person. However, post-pandemic data points to an overwhelming global deterioration of psychosocial well-being among workers, particularly teachers, leading to a drop in individual outputs. Indeed, education has always been a priority for the global world for many years. From the first education forum in Jomtien in 1990 to Dakar Education Forum in 2000 and Incheon in 2015, the focus has always been on providing education for all. It is also a fact that teachers are the core of education. The more effort we put into ensure that learners learn and learning outcomes improve, the heavier the teacher's load becomes. We declare austerity in education financing and still expect higher outcomes. That means heavy load on the teacher. That means pressure on the teacher to do more. And that means the teacher burnout. It is generally known that teaching is one of the most complex and challenging professions, yet less rewarding globally. Teachers go through a lot as they struggle to cope with the pressures of their work, such as new curriculum, large class sizes, inadequate logistics, disruptive learners with complex issues, changing knowledge and teaching strategies, overbearing parents, improving test scores, intensive supervision and demand for accountability, workload, poor pay, lack of motivation, and neglect of well-being. Poor teaching environment and unsafe schools make the situation worse. Unsafe schools, school buildings, poor sanitation, lack of restrooms, nutritional issues, absence of basic social amenities such as potable water, electricity, communication infrastructure, transportation, and health facilities leave teachers traumatized from the very first day they are deployed. There are parts of our continent that teachers go to school dreading their safety. Attacks on schools, including teachers and their learners, is commonplace in many parts of Africa. When the well-being of the learner is not properly catered for, it brings a lot of suffering on the teacher. Teachers' sympathy for learners who share their traumatic stories with them leads teachers feeling worse as they go to bed bearing their learners' troubles. These pressures drive teachers to the edge and create a lot of psychosocial challenges for them. Such mental health challenges come in the form of anxiety, depression, and post-traumatic stress disorder. They may also lead to emotional health challenges such as mood swing, negative feeling, panic attacks, loss of confidence, and motivation. Indeed, WHO in September 2021 reported that globally, the education sector is one of the most affected on mental issues. In October 2019, The International Journal of Education Development revealed that teachers show high rate of premature retirement compared to other professionals because they were much exposed to mental health hazards such as depression, anxiety, and somatophobia. ESP in the UK reported that 81% of teachers experience work-related stress. The Counseling Center of Singapore in September 2021 reported that more than 80% of teachers had mental health issues. NEA 2011 reported that 50% of teachers in the US complain of daily stress higher than general population. Unfortunately, not much data could be generated about the psychosocial issues of teachers in Africa. This is not surprising though, as education systems in Africa have not taken teachers' mental health issues as seriously as expected. Of the many years I have practiced as a teacher in Ghana, I have never had the chance of being exposed to psychosocial well-being. Of the many years I have worked as a teacher unionist, both at national and international level, I hardly come across any strong advocacy for mental well-being of teachers. I may not have empirical data backing these assertions, but I believe most of you here will bear me out that this is the truth. It has now become clear, according to UNESCO and partners, that the war against learning poverty cannot be won without factoring the psychosocial well-being of teachers and their learners. Our classrooms need mentally fit teachers to make learners feel safe to learn. The pandemic has exacerbated mental health challenges of both educators and their learners, and is negatively impacting learning outcomes on the continent. This is corroborated by the Education Response Monitoring Report by the African Union and UNESCO that mental health and social well-being of learners and teachers were among the top challenges during and after the pandemic. Now, what can we do? Teachers require better awareness about their psychosocial well-being. Knowledge about mental health and psychosocial well-being will enable teachers seek support when necessary. They will also be able to provide basic support for learners in mental health situations. There should be counseling and psychosocial well-being experts available to teachers and learners for support. There's a need to develop policies and charters on mental health for our schools. These will ensure systematic operationalization of psychosocial well-being within the school community. There is the need for research and data generation on mental health and psychosocial well-being in schools across Africa. We need to incorporate mental health issues in the professional development of teachers, both at the pre-service and in-service level. In conclusion, I would like to say that we all have a responsibility to ensure that teachers have sound minds to teach and to support our learners. The government has a responsibility to provide policies and frameworks that will guide the implementation of mental health programs. The teacher unions and other associations have a responsibility to ensure that there is advocacy for mental health across the continent and that governments are put to ensure that they are properly implemented. I would like to say that investing in the mental health of teachers and learners is not a choice, but an obligation we owe to the future of the African continent. A resilient education is built on the foundation of emotionally strong teachers and learners. Africa needs to commit to this cause, knowing full well that a systematic approach to mental health will yield far greater dividends. Colleagues, I end my speech with a reminder of the UNESCO motto, which says, "Since wars begin in the minds of men, it is in the minds of men that defenses of peace must be constructed." Thank you very much.
Thank you so much. Thank you so much, Dr. Christian. What a wonderful keynote. Colleagues, I'm sure you've been quite impressed by the remarks. And he ended it very, very well, saying that investing in teachers on mental health issues is not a choice, but it's an obligation if you're going to have teachers who are strong emotionally and as well as resilient. So I want to give you an applause for the remarks. Thank you so much, Dr. Christian. And colleagues, in case you have comments and questions for our keynote speaker, kindly use the chat room to give your comments and questions. We'll have a session for answering those questions. And thank you again for keeping the time. Really appreciate that. You've saved us some 4 minutes. And so we are grateful for that. Now, welcome again for those that have just joined us. We request you to mute your microphones and to switch off your videos to allow us sustain through the call because of the bandwidth issues across Africa. We are going into a panel session. I request that you reserve those questions for now and comments to our keynote speaker. So we have 4 different sets of speakers, and we're going to first hear from the UNESCO colleagues. That is Dr. Jerusalem Asmerau and Dr. Remy Shawa. He's going to be representing Dr. Patricia Machawida from UNESCO Region Office for Southern Africa. They're going to be talking about the UNESCO regional intervention on strengthening mental health and psychosocial support for teachers. Over to you, colleagues, for your presentation. You only have 10 minutes. Thank you very much.
Thank you so much, Dr. Victoria. I hope that you can hear me loud and clear. We'll start off with just an overview of the UNESCO O3 program, and then Dr. Jerusalem will take over to talk about the collaboration we've had around mental health for teachers. So I'll quickly just go through the slides just to state that the O3 stands for Our Rights, Our Lives, Our Future, which is a flagship program for UNESCO being implemented now in over 35 countries in sub-Saharan Africa. We know that there is a very strong link between health and education, because healthy learners learn better, and better educated learners have the knowledge and skills to be healthy. And also the fact that we need to strengthen the linkages between the school system, the education sector, as well as the health sector in order for us to achieve the Sustainable Development Goals. If there was any time that this link was very much highlighted, it was around the COVID-19 pandemic, where we saw the impact on the education system. So investing in school health systems is a smart way for countries to improve the health and education prospects of today's learners, but also in securing the future leaders. Our region, sub-Saharan Africa, 99% of children of primary school age and 44% of children of secondary school age are enrolled in school. Therefore, this makes schools a very unique setting where we can do a lot of prevention efforts and really promote education. Across all countries in the developed and developing world, learners' health is at risk, and this is an impediment to achieving the Sustainable Development Goals. We can speak about learner pregnancy, early and unintended pregnancy, gender-based violence in and around schools, school dropouts, etc. So with this background in mind, UNESCO has partnered with ministries of education and health in the 35 countries to implement an ambitious program called Our Rights, Our Lives, Our Future. The vision and goal is for children adolescents and young people in sub-Saharan Africa that are healthy, educated, and empowered to thrive and to reach their full potential, to contribute to the development of their community, country, and region. And we hope that we can do this by reducing new HIV infections, early and unintended pregnancies, gender-based violence, and child marriage, and increasing school completion rates at all levels. The O3 program has 5 ambitious objectives. The first objective is around supporting an enabling policy environment for the implementation of sexuality education, as well as the delivery of sexual and reproductive health services. The second objective is around promoting the delivery of good quality sexuality education, and that speaks to issues around curriculum support, development of teaching and learning materials, using digital technology to reach learners, but really ensuring the quality of the CSE that is delivered at the classroom level. The third objective is around promoting youth agency to make responsible decisions on their health and well-being. That is, building the capacity of young people and youth-led movements for them to be able to be change makers, informed decision makers, and contributing to their society. The fourth objective is around safer school and community environments with linkages to health services. And that is important to link learners to health services, which include fairly and squarely mental health and well-being. And the fifth objective is supporting evidence in order to inform programming, as well as the work we do on sexuality education, as well as SRHR. What you're seeing on the screen is the program coverage. We have a target of about 39.6 million learners that we want to reach by the end of 2027. We want to reach 206,000 schools, 550,000 teachers, both in pre-service and in service, and 50 million stakeholders, which include parents, religious and traditional leaders and guardians, as well as community leaders. We have countries across sub-Saharan Africa region which are split into program accelerated countries. In the program acceleration countries, the technical and financial support is significantly more, as well as in the focus countries who we prioritize for different interventions. The networking countries mainly benefit from different regional resources and also collaborations that we have. So this program, in ending, let me say, this program is primarily targeting learners, young people. But we understand the importance of reaching the teacher so that the teacher is in a better place to be able to reach the young person. And that is why the mental health and psychosocial support work that we've been doing with ICPA is really important to secure the health and the well-being of the teacher so that they're able to teach better and reach the learner as well. Thank you so much. And now I'll hand over to Dr. Yerusalem to finish off.
Thank you so much, Remy. As you're handing over, I'm just reminding colleagues again, once you join, kindly mute your microphone, switch off your video so that we can sustain the call because of limited bandwidth in Africa. Thank you so much. Over to you, Dr. Yerusalem.
Thank you very much, Victoria. And Dr. Remy, would you mind to take off your presentation so that I can project mine? Thank you. Okay.
And we also request you to use the chat room for comments. We are taking note of the comments and questions, especially to the first speakers. Just in case you have any questions, comments, we are taking note of them. Please use the chat room to write those comments. Thank you. Over to you.
Thank you very much, Victoria, again, and also the KIX team for inviting us to share our experience on mental health and psychosocial support. Can you see my screen?
Yes.
Okay, thank you very much.
Mode.
Okay. Okay. Okay, let me try it again. Yes. Okay. Sorry, 1 minute, please. This one. Okay. Thank you very much. Thank you, Victoria and KIX team again for inviting us to share our experience on mental health and psychosocial support for teachers. And I will directly go to the why this partnership between the UNESCO ICBA and the UNESCO multi-sectoral Regional Office of South Africa. And this is a partnership program through the O3 program, as Dr. Remy mentioned. And this is specifically to build the resilience and strengthen the mental health and psychosocial support for teachers and teacher educators in African countries during and post-COVID-19 pandemic. As Dr. Christine was mentioning, the COVID pandemic was really an awakening call on what's happening to teachers despite the daily routine challenges that they have been facing in the teaching and learning processes. So the objective of this intervention has 5 objectives. The first objective was to generate evidence-based research, and we had conducted the psychosocial impact of COVID-19 pandemic on in-service teachers and learners, as well as identifying the capacity gaps, innovations, and good practices or strategies that exist at the national level to address this challenge, and also to develop a regional strategy that the African member states can use to support teachers and teacher educators. The third objective was to develop evidence-based mental health and psychosocial support manual. And the other objective was to train and capacitate the primary and secondary school in-service teachers and teacher educators on the area of psychosocial support, as well as on how to contextualize the program at the country level. And the final objective was to document good practices and facilitate experience sharing for all countries. And this kind of platform is one of the strategy we were aiming to share our practices. So far we have conducted a regional study, and it was done in 2021 while the COVID pandemic was really challenging many of the member states, and 14 countries have participated in the assessment with a sample size of sorry, colleagues, are you seeing the project, my presentation, or?
Yes.
Yes, okay,
moving,
thank you.
Yes.
It's holding. Yeah, I think for some people it's holding.
Yes.
Okay, let me share it again. Sorry for the inconvenience.
And I'm requesting that in the interest of time, I think you
Yes.
keep moving, because otherwise
Okay.
we lose a lot of time.
Okay, so
Yeah.
the assessment has indicated that the most felt psychosocial impact affects teachers and educators was depression. 31% of teachers and educators, 33% of educators have reported. And the second major challenge was anxiety, which affects 24.6% of teachers and 25.5% of teacher educators. So stress was also mentioned as a third level, and it was manifested in different forms: irritation, aggression, loss of control, fatigue, exhaustion, sadness, and loss of memory or concentration was identified. So the study also recommends on how to strengthen the psychosocial support interventions at the national level, and on how to integrate it at the curriculum and teacher training strategies. So based on that, one of the success of this intervention was a draft strategy that is developed at the continental level to promote mental health and psychosocial support for teachers and teacher educators. And this is at the final stage of endorsement at the AU. So to give you an overview of what this strategy is all about, the goal of this strategy is to improve mental health and psychosocial well-being of teachers and teachers educators, so as to contribute for the achievement of the education agenda. So this, in terms of the theory of change, we are assuming that if countries provided a package of interventions that aim to strengthen the resilience and the preventing of mental health and psychosocial support among teachers and teacher educators. They will be in a better position to be able to deliver quality teaching so that it will contribute also for the learning outcomes and quality of education across Africa. So we are expecting by 2030, all member states will have scaled up the provision of mental health for teachers and educators across all levels. And we have an indicator for that. We are expecting to see by 2030 that increased number of countries that integrate mental health in their pre-service teacher training curriculum, and number of countries with policies and coastal strategies will be in place to prioritize mental health for teachers and teacher educators, and the percentage of schools that provide comprehensive package of mental health interventions will be improved. So for that, we are building on the intermediate results, like improving the enabling or creating enabling environment for mental health and psychosocial support across policies, legislations, and financing systems, including creating a multi-sectoral approach and referral linkage with our different agencies, capacity strengthening at all levels of the education system, making sure the operational guidance, foundations, frameworks, and systems are also in place, and as well as close monitoring and follow-up. So with all these interventions going on, we also had trainings. We piloted the training module in 5 of the countries: Ethiopia, Eswatini, Uganda, Kenya, and the training has reached more than 35 regional master trainers and 185 trainers at the ministry officials, teacher educators, head teachers, union representatives, teachers, and some of the NGOs who will later also share their experience on this area. And so for the next 2 or 3 years, we are planning to develop evidence-based mental health counseling guide for teachers and the young people. Now we are working on the teachers, as Remy was mentioning, that it's important to address the teachers issue. But while addressing the teachers issue, also we have learned that teachers still need a tool to support children and the young people when it comes to mental health and psychosocial support. This is because of the different aspects of psychosocial issues happening in our learners. There is a substance abuse, there is a stress, and there's lots of traumas among our learners, especially for those areas who are affected by crisis. And we are also planning to develop a pre-service teacher education guideline on mainstreaming mental health at the training institutions, establishing a regional virtual community of practice among trainers and stakeholders to maintain the peer learning opportunities, or to create a learning platform is one of the plans that we have. And we are also organizing a national level training of trainers to include some other countries who also show up an interest to be part of the program. And we will also work more on the providing technical assistance for countries to implement that country level capacity building, especially for learners and teachers. And thank you very much, Victoria. I hope I didn't take much of your time. Thank you very much, and over to you.
Thank you very much. Sorry about the hunch on the slides that got frozen, but the good thing that all participants here have registered, and you've included your email address at the registration.
Thank you.
So we'll be sharing the slides with you. And sorry about that, colleagues. And thank you so much, both Dr. Remy and Dr. Jerusalem, for your presentation. So colleagues, just don't worry, we'll share the slides with you. But I'm sure that you've had some key points where she's talking about the status of stress and anxiety among teachers, and depression ranging from 31% to 50% across the countries where the study was undertaken. And it's not different from what our keynote speaker has also presented for Singapore, which is 80%, and for the teachers who are reporting daily stress in the USA, which is at 50%. So there's quite a lot that is going on. But let's hear from the next panelist. That's the Eswatini group, Dr. Lindwe, and talking about how they're institutionalizing evidence-based mental health and psychosocial support services for teachers through teacher education in the Kingdom of Eswatini. Welcome again, colleagues, and over to you, Dr. Lindiwe. Over to you, Lindiwe, the Director for Education, Testing, Guidance, and Psychological Services. Over to you, Dr. Lindiwe.
Thank you. Thank you very much, Victoria and colleagues. A very good afternoon from the Kingdom of Eswatini. I'll be presenting on the institutionalization of evidence-based MHPSS in teacher education in the Kingdom of Eswatini. However, I will start by giving a brief background on the issue of the major drivers of MHPSS. It all started in 2000, where Eswatini was experiencing high prevalence amongst the age of 15 to 14. It was 46%, which was it was highest in the world. We were leading, and we had high numbers of deaths. So according to UNAIDS 2006 estimates, they were actually saying 220,000 people were were positive with HIV and AIDS. So as the pandemic continued to unfold, it had a negative impact at school, family level, and at community level. So one of the most visible signs of this devastation was the endless swelling tide of orphans and vulnerable children in our schools. Children were heading homesteads, schools, and other educational services were now left with the burden of playing caregivers and providing psychosocial support. As such, the teachers now were left with such burden. As such, they were experiencing burnout, stress, and then the Ministry of Education noted that it needed to act and have a school intervention program where it was taking care of both learners and the teachers. So that was creating a challenge to the education sector. And then the Eswatini Ministry of Education also noted that the teachers were dying in volumes. So according to the World Bank's Education Sector Analysis Report of 2021, the death of teachers due to HIV and AIDS it's still very high, and it attributed that into poverty. And then teacher salaries has always remained stagnant since 2016 due to the country's fiscal challenge. Meanwhile, the standard of living has risen. As such, it is causing stress to our teachers. And then Eswatini also is providing educational grants, which is free primary education, and OVC grants, which have remained stagnant and resulting in school administrators suffering stress because they have to make means from the leaky support that they are getting from the leaky grant that they are getting from our government. So also the Eswatini education system was also affected by COVID-19 pandemic, which also created a further burden on teachers. Another trigger in 2021 was the civil unrest that the country experienced, where schools were banned and teachers feared for their lives. And this necessitated on the issue of mental health and psychosocial support. I think you can see that picture where there was riots in our schools, something which was never imagined in Eswatini, which created a fear into our teachers. And then I will quickly move into the policies and interventions. The policies and interventions in 2007, we quickly put together a national multisectoral response to HIV, and that established a public sector HIV and AIDS coordinating committee, which is known as PSHAC, where all issues of wellness now sit, or they are being chaired or coordinated. The HIV public sector policy of 2004 was also developed to implement public obligations that are HIV and AIDS related. And then in 2005, ministers in the SADC region adopted the CSTL policy framework, where issues of psychosocial support was also highlighted to be a key or essential component that needs to be taken care of in the education sector. And then the Ministry of Education sector policy of 2011 directed the Educational Testing, Guidance and Psychological Unit to provide psychosocial support services to schools. And so does the revised Education sector policy of 2018. I think now you understand why my department is the one that is in secretariat, or that is pushing the agenda of ensuring that issues of mental health and psychosocial support are implemented or are taken care of. We also have the extended national multisectoral HIV and AIDS framework of 2014 and 2018. As the issues escalated, more issues have been incorporated into the framework. And then the education sector policy mandates the unit to program for learners and our teachers in the different health issues, being PSS and mental health being one of them. In terms of institutionalization, what the country has done, it's set up the committee or the structure, which is known as the PSHAC, where all undersecretaries in the different ministries that are administrative, they chair the meeting, and we have a wellness coordinator, and we have a human resource officer, and we have an association representatives and representative for all departments. And this is uniform to all the government ministries. And ETGPS was made to be the secretariat where the budget sits. In principle, all ministries are supposed to get 5% of the total budget of each ministry, and that budget is meant to cater for issues of drugs and participating in the special days, for example, when we commemorate the World AIDS Day. And then interventions or strategies that we use prevention, we raise awareness through workshops. We also observe special days. We provide psychological services. We have psychologists in our regions, and we have counselors in the Ministry of Education, and we do staff developments in the different schools. And we have PSHAC support groups, and we also have wellness corners in the different ministries. In extreme cases where a teacher needs more support, those cases are then referred to psychiatric center, where they are taken care of further. And in the teacher education, we also have a module that is from REPSI, where we are offering a diploma to pre-service teachers. And in our University of Eswatini, we provide a certificate course on psychosocial support, and we do research time and again. In partnerships, we have the Ministry of Health, the Ministry of Public Service and Information, World Impact, UNESCO, REPSI, World Vision, Teachers and Principals Association, and Ministry of Labor and Social Securities. I thank you. Over.
Wow, thank you very much. Director Lindwenana Lamin, the Director for Educational Testing, Guidance and Psychological Services, are from the Ministry of Education in the Kingdom of Eswatini. Thank you so much for your wonderful presentation. Colleagues, again, feel free to put in your comments in the chat room and questions. We will address them quickly. Allow me to move to the next presenter. Now, this is the Ugandan team. We have the Secretary General for the Uganda Union of Teachers, UNATU, Philbert Bates Baguma, and Vincent Mujune, who is the Acting Country Director for Strong Minds Uganda. And they're going to be talking about advocating for and creating safe spaces for teachers to support them on mental health and psychosocial support. Over to you, colleagues. I don't know who is going to present first. Over to you.
Good afternoon. Good afternoon. Thank you very much, Dr. Victoria. Myself and Philbert will be presenting. We have a two-part presentation. I will start, and then Philbert will follow briefly, just to keep the time. If I could be allowed to share my screen, I will go ahead and share.
You're allowed, please go ahead.
All right. Oh. So in our sharing, we are basically going to be talking about the advocacy work and safe spaces that is really coined from the Ugandan perspective. My colleague Philbert will do a good part harmonizing that with the work that the National Association of Teachers is doing in Uganda as part of that. So just to echo onto a lot of what has been spoken, I think the context painted across Africa and in other contexts is so clear that teachers and the plight of teachers as far as MHPSS is concerned is not a debate that we should be questioning, but more a debate that we should be embracing and taking to different spaces for policy and engagement. Our presentation is specifically focusing on advocating and creating mental health and psychosocial support safe spaces for teachers in Uganda. Myself and Philbert will do that. I represent an organization called Strong Minds, and we are a social enterprise that is treating depression to scale, including interventions that we are doing with teachers and adolescents in school, and we are a Ministry of Education partner. I will proceed with my slide just to keep in time. I feel the thing that I would like to share with the people here is something that is a bit more peculiar about the context for the teachers, the plight for the teachers, if you can look at this slide, you will appreciate that teachers are actually completing suicide, even as we see them doing the work that they do, suffering a lot of stressful experiences, stretching from socio-economic related stressors, and a lot of them related to their own teaching conditions and that they deliver their services. About this is just an excerpt from the Ministry of Education, the Counseling and Guidance team. We are doing an inventory of all suicides that are happening both for students or learners and teachers. And this is not looking good as far as teachers' psychosocial well-being and mental health is concerned. From the context of advocacy, I just wanted to bring the team here observing this webinar that there are two contexts that we are looking at here. There is the context in the red area, which we feel is more in the area of our focus for advocacy, influencing mainly the policy and societal norms that exist as far as the teacher's well-being is concerned, but also at the safety side, looking at safe spaces, especially around organizations and communities that help us to appreciate how we can make teachers secure in the process of delivering their career. And we are building this a lot from the socio-ecological model as a guide for us on how to intervene. Some of the responsive things that have happened in Uganda that would be interesting for this forum is that the Ministry of Education in Uganda in the year 2020, last year, put in place a circular that was specifically focusing on to the mental health and psychosocial services in school. And they specifically put this circular in place to support teachers and learners, particularly to have time for mental health and psychosocial support services in their school calendar, especially every week. And we've seen that working through starting the baby steps. We are still yet to have firm guidelines to help us to guide all schools and institutions of learning in Uganda on how to observe the circular to scale. We've also seen that the Ministry of Education in Uganda has taken steps to establish a counseling and guidance technical working group, something that was not there before. But because of the advocacy work that has been done, we see some responsiveness in here, and the technical working group is mainly intended to provide direction on all mental health and psychosocial interventions in the country. And we've also seen other reforms happening with the revised Ministry of Education revising the management information, education management information system, and including 4 indicators for MHPSs in the way that schools and institutions shall be reporting back about mental health and psychosocial support. And then in our country, we also have the Ministry of Health leading on the school health program. And the school health program has also been going through reforms specifically with the standard services expected under the school health docket. And what we've seen in this case is that a lot of the previous work that focused on to the adolescent and sexual reproductive health is going to be integrated with mental health and psychosocial standards, which is still a positive space. And then lastly, in the reforms that we've seen from the advocacy work that has happened at policy level, we've seen that the Ministry of Health and Education are leading the process of developing an interministerial committee on mental health and psychosocial support. And this is in recognition of the fact that mental health is not a health alone issue. you realize that empowering the teacher requires quite multiple sectors to support the teacher, especially in as far as their mental health and psychosocial well-being is concerned. And so that's another milestone that we are moving in Uganda. And then lastly, in recognition of the work that has happened in Uganda with the safe spaces, we as a country were supported by UNESCO ICBA in partnership with Ministry of Education and UNATU. We had a training of the first master trainers for mental health and psychosocial support this year. And we have seen that evolve and grow into another tier of training, which has been organized at country level with the support of UNESCO, particularly training national trainers. And our target is targeting both the in-service and pre-service teachers so that we create a cadre of MHPSS support teams and trainers that can extend this to other contexts. And then the mental health circular that has developed by the Ministry of Education is also openly specifies spaces for teachers to go for psychosocial support. And some of them are online resources, some of them are MHPSS helplines, and all these are intended to make sure that in the interim, the teacher has an opportunity to receive care. And some of our work in Strong Minds has also seen some teachers trained in how to provide therapy, and many of them are also providing care for their peers. Now, when you look at the work that we are focusing on from the Ugandan context, the MHPSS action plan that we developed for the country targeting pre and in-service teachers in Uganda for 2023 to 2025 is really here that I am casting for you, looking at strengthening mental health and psychosocial support for teachers in Uganda for improved learning outcomes as our goal. And we have 4 major objectives to operationalize that, particularly looking at developing education strategies and guidelines to mainstream MHPSS for teachers, building capacity of school stakeholders, to coordinating and implementing MHPSS interventions in school, and finally, investing in operational research, monitoring and tracking the implementation of MHPSS work. Our main target is teachers and learners, because we know that teachers are core caregivers for not only the learners, but also the community where they come from. I'm glad to stop here, and I'll introduce to you my colleague, Philbert Baguma. Philbert, if you're there, please join us. Ready for your presentation.
Thanks a lot.
Philbert, are you ready?
I'm trying to see whether he's still online. He's been probably having issues with connectivity. Let's just question quickly.
I am online.
Wonderful. Hello? Wonderful. Please go ahead.
Great.
Please go ahead.
Great.
Yes.
I'm just removing this, and I'm putting Philbert's presentation so that he can talk us through the work that we are directly doing with the teachers in different contexts to support MHPSS work. Yeah.
And I should say he has 6 minutes only. Okay.
Yes. I will summarize.
Great.
Yeah, Philbert, you can start talking. I'm creating the sharing.
Okay. Thank you, Doctor and colleagues online in this webinar. From where Vincent has stopped, I want to re-emphasize that mental health is as important as physical health. We can no longer afford We can no longer afford to ignore mental health and psychosocial support for teachers simply because teachers play a paramount role in providing mental health and psychosocial support to their learners and in sustaining resilient education systems. Therefore, supporting teachers' own well-being is essential if they have to fulfill this role. And UNATO has noted that teachers' mental health challenges have become
Gilbert, we've lost you. Please, are you still with us? Gilbert?
The sound is not clear.
Oh, yeah. Okay. Vincent, do you want to continue? How do we move forward quickly? Because you have also a few minutes remaining. Hello, Gilbert? Okay, we've lost him.
Hello?
Yes, we lost you, Gilbert. Can you continue, please? You only have 4 minutes
Yes.
remaining, please.
I was saying, away from what Vincent presented, we have so many cases of committing suicide by teachers, learners, and parents and guardians. So the story does not end with teachers only, it stretches to the parents and guardians. Now, what are these issues that are affecting the mental health of the teachers? One is the high cost of living due to the current situation as we move from COVID-19. We are also having multiple loans. Teachers, because of the meager pay, they have invested a lot in multiple loans, and this is torturing them too much. The general low public regard is another issue because this has caused a lot of issues mentally and psychologically. Some of the teachers who upgrade at their own cost do not have a consideration in terms of salary and rank. And this keeps lingering in their minds and affects their mental health. Disparities in salary payment and enhancement. Uganda is on record as a country that has decided to discriminate their teachers and other public service workers. And this is unfortunate because it has caused hostility at the workplaces, and this is not good for the children who are innocent. We have hostilities, attacks from rebel groups. We had in 1998 a technical school which was attacked and 80 students were killed. In June this year, another secondary school was attacked and left 37 learners dead. This does not leave the teachers safe because they keep thinking they are the next in the queue. Then we have limited psychosocial support services. These services are limited and the teachers need to be prepared and supported so that they can in turn support the learners. We have the refugee context. You all know Uganda is a host country for most refugees from the neighboring countries, and this affects the mental health of the teachers, the mental health of the learners, and therefore there is a need for mental health and psychosocial support to have the teachers prepared so that they can in turn prepare and support the learners. Natural calamities, the floods, bursting of river banks is another challenge. Now, how do we come out of this? if we have to attain quality education. We have to look at the idea of teachers, because when we have the teachers prepared mentally, then that means they will transfer this to the learners and we attain quality education. We have also noted lack of support systems and structures that exist for teachers to help them recover from the traumatic experiences at the workplaces, and therefore this is something we feel should be done if we are to save the situation. Now, as Uganda endeavors to build a strong nation and deliver quality education, it is very crucial to prioritize the mental health and well-being of the teachers. And lastly, advocacy on mental health and psychosocial support should aim at making a loud call to government of Uganda and other governments in Africa to strengthen mental health and psychosocial support systems within the education sector. This will create a conducive learning environment that fosters the growth and development of both teachers and learners, and therefore this remains a vital ingredient in the promotion of quality education for all. Thank you very much.
Thank you so much, Philbert, for sailing through, and Vincent, we truly appreciate your presentation. The time is flying. I again request colleagues to mute your microphones and also your video so that we allow the speakers to present. Quickly, allow me to invite our colleagues from Ethiopia, from the Ministry of Education, Petros Melaku, yourself. He's an education expert, and Mogus Gabriel-Mariam, a counseling psychologist from AHA Psychological Services, to talk about the counseling models and approaches and practices that they are using in Ethiopia to enhance the social behavior changes and resilience and coping mechanisms for teachers. Over to you, colleagues in Ethiopia. Thank you very much.
Thank you very much. Can I proceed?
Please go ahead, Petros.
Thank you very much. This is Petros from Ethiopia, Minister of Education. As Dr. said, I'm an expert there, working on teachers and leaders development. So I will start on my presentation. The mental health and psychosocial support training we have for teachers, educated leaders in Ethiopia is an important event that we need to proceed, because it is an issue of building resilience to humanity and shock. We need teachers to intervene to the problem society. So through teachers, we will go to learners, and then through learners to the community. So Ethiopia recognizes the importance of mental health and psychosocial support because we have challenges in the education sector. So the education sector is highly challenged by the different problems that we faced these days. Am I audible?
Yes, you are.
Yes. Yes.
Because I'm out of Addis, I'm suspecting the connection. So because Ethiopia needs MHSS in scale, as we even the education sector is suffering from different challenges. With the conflict, for example, hundreds of thousands of people and millions of learners were affected, according to disaster response assessments that we made in 2022. So the effect of the conflict, drought, and even COVID is more than this. If this is the case, and we believe that teachers play a pivotal role in supporting the well-being of learners and in balancing the teaching and learning process, so that we want this MHPSS to be conducted in our systems. And plus, we found that teachers lack Teachers lack the necessary knowledge, skill to address mental health issues, so they need capacity, they have a role. The education sector is highly affected. Due to this very reason, we in Ethiopia need to move MHPSS for teachers and school leaders in scale. And plus, when you see the context of our country, many students, many teachers themselves lost their loved ones, their families, children are sustained injuries, and significant number of girls reported sexual abuse. So millions of people are internally displaced. So to balance this, we need an intervention which is through teachers and through the school system. So we highly demand MHPSS in our country. For example, in conflict, for example, more than 2,681 schools were destroyed completely, and then more than 4,000 partially. So this damage, and then the 4.2 million school children affected through war demands our indeed. So as we are affected by different situations, we really demand MHPSS, and then we started the intervention last year. The situation in Ethiopia demands the need for MHPSS because Ethiopia faces significant mental health burdens among its population because of the conflict that we had. And then students, as seen in the background, were suffering a lot. Because of the reasons they don't know, they are suffering. And then according to study, the prevalence of mental health disorder among students is about 17.9%. And these conditions can adversely affect the students' academic performance, social interaction, and students' well-being. So these all things demanded MHPSS to be conducted in scale, and we Ethiopian Ministry of Education believe that having MHPSS in place is a must. It's not an option. And then training programs on mental health, psychosocial support for teachers, education leaders is found to be critical in our context. So we understand that it is important for the teaching and learning process to be smoothly delivered. So these programs aim to equip educators with knowledge and skill to identify the different psychosocial support needs, problems, and refer students who might experience to further supports to the professionals. And then by enhancing their capacity, teachers, education leaders can create a supportive and inclusive learning environment. So believing this, we have been running MHPSS starting from last year. And then by 2022, we designed a training initiative in collaboration with different government offices, Ministry of Education, Ministry of Health, and Ministry of Social Affairs from government side, and non-government organizations for technical and financial support, and professionals in the field. Educators, experts who are experts in mental health and psychosocial support were summoned together to develop a working document for intervention. So the design takes into account local context, the context of Ethiopia and different places, cultural considerations and specific needs of the beneficiaries. Whenever war related, whenever drought related. So, and challenged by the teachers and students in Ethiopia. So by bringing these different people together and mobilizing the resources, financial and non-financial, we started the planning. Major activities were done by 2022. The thing that we have done is we developed synopsis, working document, and then document development for training, where we used that document to train master trainers at national level, about 30 number, and then TOT for 450 TOT participants. And then in actual training, we did it in scale. For example, in a shoot, we have been participating more than 3,000 participants in different centers, having this trainers that we produced earlier. So the key topics of the training were very many in number, and among this, integration of HPSS in teaching learning process was a very important topic we found for teachers to integrate mental health, psychosocial support activities, issues into the teaching learning so simply. The other is ensuring quality teaching and learning in emergency context is other topic that we try to contextualize. Hello. Hello. Can you mute please yourself? About 11 topics, and among this, we had about 11 topics, and among this, that are very contextualized and localized to local context about quality in education, while MHPSS needs are there, and integrating the different MHPSS points topics into the teaching learning. So having this, by doing this, our achievement was Ministry of Education in collaboration with GQPE, about 32,269 trainings were participated for 3 days. Actual training was for 3 days. The TOT and the master training sessions were for 5 days. As you see from here, the training was very intensive. And then with the support from UNICEF and UNESCO, we had about 3,783 trainees at different places in Ethiopia. The total number of participants in this regard were about 37,000. This is in a scale. Many teachers have got the opportunity on this training, but still it is insignificant as we have many teachers in the system, because we are 700,000 teachers. When we do these things, and while we are planning to do MHPSS in the future, we have so many challenges. It was not easy to get different ministries together. As I said, 3 different ministries come together for this purpose, but we, the Ministry of Education, were doing it alone.
Sorry, Petrus, you have only 3 minutes remaining for both of you. Only 3 minutes for both of you.
Thank you. Different NGOs were acting alone, but unfortunately, we can't mobilize the resources, so we lack efficiency in this regard. The other challenge was limited resource. We had limited resource in terms of funding, training materials, time constraints. However, we tried to do it in a scale. So problems with an ongoing support and supervision was there also. We are not supporting them on the field while they are doing it. Inability to see significance of MHPSS remains a challenge. Different actors, stakeholders couldn't see its significance in the education system. They are considering it as business as usual. The opportunities and lessons learned, efforts has been made to integrate MHPSS into the education system for sustainability, but we couldn't able to put it into the curriculum. One of the universities that we have, an education university, has included it into the curriculum. So initial training is considering MHPSS topics as one of the courses. With the leadership of MO meetings can be done in a scale. So we saw that whenever things are done at central level, we can address so many teachers out there. So it's possible to cover in scale. Coordination between MOE with academia, universities, colleges, and development partners enhanced our participation. The resources, the expertise we bring together was helping us so much. To conclude my presentation, providing mental health, psychosocial support, training for teachers, education leaders can help us to promote the well-being of learners. And then by equipping educators the necessary knowledge and skill, they can effectively identify, support students' mental health needs, and create positive and nurturing environment. So the way forward, we need national plan involving all actors, government, and NGOs, and then doing MHPS in scale by coordinating all actors, training to reach all teachers through school-based MHPS program helps a lot for the quality of education that we need. Thank you so much. Together we can, and my colleague, a professional, Mogus, can proceed. Thank you so much.
Thank you very much. So you've used up the time for both of you. Now, I don't know how to treat this because one presenter has used all the minutes. Mogus, I will only give you 3 minutes.
Victoria, can we give Mogus 5 minutes? Because I'm looking at, and we don't have too many questions, but reflections. So we can give him 5 minutes. Thank you.
Okay, I'll be strict with 5 minutes, Mogus. Over to you, quickly. Can you start speaking meanwhile, Mogus? Introducing yourself or something like that?
Good afternoon, everyone. Thank you very much, UNESCO and KIX Africa, in organizing this very important webinar, because I believe there is no health without mental health, especially for teachers. So my presentation is mainly targeting the interventions we had at AHA, focusing or targeting learners, because most of the speakers talk about teachers' well-being. As you know, this well-being issue in a school has its own vicious circle. Whenever there is depression among the teachers, it can also be reflected back among the learners. Okay, so we have so many interventions, but I'll picked one of the very evidence-based one we did in southwest part of Ethiopia in 118 schools. So our intervention was individual and group counseling focused on this cognitive behavioral therapy technique. Yes, and we have a theory of change for this intervention. Since it is a social and emotional learning focused intervention, we are envisioning to have this model, this individual and group counseling approach will enhance self-awareness and social awareness of the learners, and at the same time, it would enhance their social management skills and self-management skills, as well as their self-efficacy in terms of improving their education performances. And we adopted the Castle model and other models from American Psychologists Association. So the individual counseling session went for 8 sessions, which is nearly for 3 months, and the group counseling session went for 2 months, which is about 6 sessions, which has been held weekly, targeting again adolescent girls from grade 5 to 8, because adolescent girls are severely affected by different adversities. And when we see the emotional burden of girls as compared to boys, girls are highly heated, so that that's why we focused on girls. Next slide, please. So yes, to make it evidence-based, we used 2 major tools to on the improvements of their social and emotional learning, and again to check the self-esteem improvements because of this intervention. Okay, next slide, please. Yeah, so we did a kind of baseline survey. The social and emotional learning has 7 major components: self-awareness, self-management, the social awareness, social management, and the self-efficacy skill, including the master of orientation, how they are doing their things with full confidence and doing things persistently. As you can see from the graph, their self-efficacy was very low as compared to the other competency areas. And of course, we expect this one will take more time to shape it. So we designed the intervention based on these 7 targets to tackle the problems around these 7 elements. Next slide, please. So we have a kind of tradition. We assess and we design or adapt an intervention. Then we want to make it evidence-based after intervening. So this specific intervention targeted 4,064 girls in 4 districts of south west parts of Ethiopia, specifically in Wolaita zone, and in 4 grade levels from grade 5 to 8. Next slide, please. So most of the targets were in grade 7, which is nearly 1,344 girls, and the least one was in grade 5, which was 786 girls. So in total, we had 4,664 girls targeted for this individual and group counseling component overall. Next slide, please. So here is the output in brief. So we tried to compare the baseline with the underlying. So the pre-assessment or the baseline for self-awareness was, it is a kind of mini score, 1.61, but after the intervention, it was improved to 2.5. So the score is, the maximum score is 4, so you can compare it based on the maximum score and the minimum score, but it is compared based on mean or average score. In order to save our time, you can focus on the self-efficacy part. Yes, we tried to track the improvement in self-efficacy. You can see improvements again in this part as compared to the baseline. So it indicates how they are improving even towards their academic performance once they improved their social and emotional learning as well as their self-esteem. Next slide, please. And there is also improvement in their self-esteem, but this improvement also varies from grade level to grade level. So the most improvement is in grade 5. It's increased from 2.5 to 3.07 during the baseline. So there is kind of slight improvement in terms of social and emotional learning as well as the self-esteem of adolescent girls. Next slide, please. So in conclusion, we found out that cognitive behavior focused therapy using individual and group counseling techniques enhanced the social and emotional learning as well as the self-esteem of girls, and their confidence has improved, their coping mechanism enhanced, and their resilience also improved to cope the adversities and different life challenges. So in this process, we trained for 172 teachers and 26 school counselors. And as we also expect a kind of peer-focused counseling, we trained 1,152 peers. And we also trained 182 school principals, as well as 64 school supervisors to mainstream and integrate this individual and group counseling in the school systems. And finally, we try to make it evidence-based, and we expect this to be scaled up at national level. This is the conclusion from our intervention. That we have also lessons we took. So it is always good and advisable to use the golden triangle approach, focusing on students, learners, neglected teachers, and parents. Thank you very much. Back to you, Dr. Victoria.
Thank you so much, Moges, and we really appreciate giving us a snapshot of some of the outcomes in terms of data representation. And thank you very much for sticking to the short time that has been accorded. We are now running out of time, so I'm going to ask my colleague quickly to pick out the comments that are coming from the chat room. Over to Yvonne. I wish you can summarize in 5 minutes so that we can have at least a plenary for question and answers. Thank you. Over to you.
Thank you, Victoria. I'm wondering whether I should, because there are questions in the chat room as well, should I start with the questions or I just summarize and then go to the questions?
Summarize the comments, then you go to the questions and you forward them to the relevant speakers. Thank you.
Thank you. So we have a lot of comments, and I think one comment that cuts across is that there's a lot of appreciation for the presentations that have been made, and they are relevant. The participants feel that the presentations resonate with what they're experiencing at the country level. I think we have about 7 comments to that effect. And then there's also a comment that teachers can help learners only if they're safe. That's also something that has been observed. So that the issue of mental health for teachers is very important. And then you cannot talk about mental health for teachers without talking about mental health for students or for learners. I think that is also something that comes across very much. And then the other issue that is been noted is that there's need to institutionalize mental health and psychosocial support. And the case of Eswatini is actually very well received. There are few countries that would really like to learn from Eswatini. And then on how to mainstream mental health and psychosocial support in teacher education curriculum. The other thing is, I think overall it's about the integration of mental health and psychosocial support in the system, the school curriculum, in policy. That is what comes out strongly from the comments. So then I'll go to the questions. And the first question is to Dr. Remy. You talked about, sorry, this is for Christian, I think. You talked about systematic integration of mental health and psychosocial support for teachers in the education sector. What will be the best entry point in your view? Then I think I'll go to Remy, then I'll take the other, Remy and Jerusalem, and then we'll go to the other presenters. And then to Dr. Remy, why are you classifying early pregnancy as a mental health issue? And then another one to Dr. Remy, is it possible, sorry, this is for all, to share the presentations? I think that one Victoria answered. We'll be able to share the presentation and the recording after the sessions. So another to Dr. Remy, thank you for the excellent presentation of the plans for the program. We have launched at Arigato, I believe that's a place, Arigato International. We have launched a fellowship program on ethics education that is active in Kenya among the focus countries which you have mentioned. How can we connect, particularly in the area of fostering child agency and participation that is also central to ethics education? And then we have one question to Dr. Jerusalem about the study that you shared. Can it be shared to a wider group, or is it limited to, or is it limited only to the participants of the study? So I think we can have those answered, and then we can move to the questions to Eswatini, Uganda, and Ethiopia.
Okay, thank you so much, Yvonne. Dr. Christian, we'll start with you and then we proceed to the other colleagues. I hope you're still online. That was our keynote speaker. Over to you.
Yeah, thank you very much, Victoria. And I think the discussions have been so insightful. The question as to the entry point for systematic integration of psychosocial well-being into the education system. Well, there's no one-size-fits-all type of thing, but as I indicated in my speech, there's a need for policy. Policy is what I think should be the first thing to look at. Every country should have a policy on mental health for teachers. And if that is done and probably the legislative framework is properly laid out, then it makes it easy for everybody to stand up to it and sign up to it. For example, if a teacher is a professional teacher, in renewing your license from time to time, maybe a fitness to teach test is conducted to make sure that you are fit to teach mentally. It will be good. So if there is a policy around it, not necessarily at the cost of the teacher, but at the cost of the employer, so that it will encourage teachers to avail themselves. Also making sure that the confidentiality and the ethics around counseling and psychosocial support are adhered to give confidence to people who want to access the services. If that is also put in place, it makes it better for people to access the services. So for me, the entry point is to develop policies at the various country level, and then making sure that in developing the policies, all stakeholders are brought on board at the ideation stage, not when policies have been done and cooked, then it's presented. For example, if you take teacher unions, their members are worse affected. And so if you're going to develop any policy of this nature, you need to get them involved, making sure that their inputs are well captured. Other partners in education sector must also be consulted properly. Beyond these, because of cost and other things, partners are also important in this whole issue, because if you have partners like World Bank, UNICEF, UNESCO, and many others, NGOs and so on, that we want to support governments across the continent to do this, that would be great, because I think the statement made by UNESCO making it clear that we cannot fight learning poverty without also fighting mental health issues of teachers. It's clear to all of us. And so anybody that's into making sure that learners learn must make sure that learners are not the only focal point, but the teacher who provides learners with the knowledge they need, or teacher who guides learners to get the knowledge they need, is also properly catered for. Thank you.
Thank you so much, Dr. Christian. Because of time, I'll just fly. It was very clear. I'll fly to Remy and then Jerusalem. But yeah.
Thank you so much. I'm not sure if the question was, why are we classifying EUP as a mental health issue, or whether the question is that is EUP a mental health issue? Could you just clarify for me, Victoria?
Yes. The question is, why are you classifying early pregnancy as a mental health issue?
Okay, no, I don't think that was what we said in the presentation, although there are strong linkages, obviously, between the mental health of the learner who has an early and unintended pregnancy, and the biological effects of the pregnancy itself. So you see that young people who become pregnant early, unprepared and without their social support are more likely, obviously, to face mental health challenges like depression and so on. Although I didn't highlight that in the presentation, the link I was giving in the presentation is that while the O3 program that we have looks at the mental health of learners, looks at the health and well-being of learners, this mental health for teachers is also important because teachers are expected to be the ones to deliver the lessons in the class, to provide guidance and counseling to the learners. So in order for us to achieve the health and education outcomes of the learners themselves, it's important that we invest in the mental health and well-being of the teachers. And then the other question was, I think, from Kenya around how we can connect on ethics education in Kenya. We are happy to put you in touch with our country colleagues in Kenya that work in this area, and maybe you can connect. And indeed, one of the areas of focus on the O3 program is youth agency, whereby we want to strengthen the skills of young people and empower them to be able to make better informed decisions, but also for them to be change makers in their communities. And then the last one, which wasn't directed to me, but I picked it up, asking what UNESCO is doing to advise African countries on the same issue. I think it was Dr. Yerusalem who mentioned about the AU strategy, for instance, that will be working together with UNFPA, IPPF, the African Union, WHO, and other partners. And it's essentially to be able to bring some of these issues, including mental health and psychosocial support, to the center stage within the education sector. Over.
Okay, great. Thank you very much. I'm going to speed up still. Our time is running pretty fast. Yvonne, you have one more round, and then we'll go to a plenary discussion, and then we just wrap it up. Over to you, Yvonne.
Thank you, Victoria. So I think there's only one question for Dr. Eros, which is, can the study that you shared be shared to a wider group? You will answer that. And then to the presenter from Eswatini, how can the initiative be passed to countries that are on the road to do mental health initiative in their own countries? I hope that is clear. And then we have a question for the Uganda team. I think there's only one. Someone is asking, where can they register for the course on mental health? And then I think the others then to Ethiopia. How does one become a master trainer on the mental health issue? This person is interested in this from Kenya. I don't think this is for Ethiopia only. I think it's for the entire team. How can one become a master trainer on mental health issue? And then Victoria, there are questions that are specifically directed to you. So I will also just ask. One is on the reimbursement issue. I've seen a couple of questions on whether they will be reimbursed and how will it be done. And then on, does drugs and substance abuse have any role to play in mental health and psychosocial support for teachers? Someone is asking, are there any studies from Kenya? What measure, sorry, that one has been answered. Is it possible to have these trainings in each country physically so that every teacher will have the knowledge? So all those were directed to you, Dr. Victoria. So over to you.
Okay, let me hear from Jerusalem first, and then I'll wind it up. Over to you.
Thank you, Victoria and Yvonne. I think the first question has been addressed by Remy. And of course, as UNESCO and in particular as ICBA, we are working with the African Union for the endorsement of the strategy, which we think is a base for us to advocate and also to work with under the multi-sectoral approach with UNICEF and other agencies, with the Ministry of Health and the Ministry of Education, with member states. So the endorsement and the uptake of the strategy at the country level will create a conducive environment for us to advocate for the institutionalization of the mental health at the country level. And yes, documents will be shared, and also contacts will be shared if possible, so that you can also chat and further take this discussion. I know that there are lots of discussions on the chat, so you can pick and also continue discussing on these issues while we share the presentations and also the contact people who have been part of this webinar. Thank you very much. Over to you, Victoria.
Okay, great. Thank you so much. Allow me just to go through also a few that have been requested, that have been asked, directed towards me. One of them is about the reimbursement. Unfortunately, no, we are not going to reimburse anybody. We thank you so much because you've received a lot of information, but also we thank you so much for your commitment and being present here. Then is it possible for having this training in each country physically? We are progressively piloting this in the few countries based on the funds that are available. And so we'll be letting you know when the turn for your country will be, if funds allow, but also we intend to have an online course at some point, and then you can be able to access the course online. Otherwise, physically may not be possible. The issues affecting the Kenyan teachers are not addressed. How can we help teachers undergoing mental health mostly as a regard to separation with family and hostile working environment? Wow, this is critical and needs further discussion. So maybe we can put in the parking lot now, and maybe we'll have a second webinar, we can address this very issue. But thank you for bringing this up. And then what are the early signs of mental health? There's a lot to say here, but thank you, T.I., for this question. I'll ask probably Morgus to talk about this, or Vincent, just quickly to talk about this. And then the other aspect from my side is what I'm just trying to see if there's anything else I've left. I think that's it for now from my side. Morgus and Vincent, what can you say quickly about the early signs of mental health issues? Over to you.
Hello.
Yes.
Thank you very much.
Okay.
Yes, burnout may be the first symptom or manifestation, but we can't be sure that it is a mental health problem. When we say mental health symptoms and signs, it may last for a longer period of time, and the intensity is very serious and deep, and sometimes we can't get rid of it without any professional support. But if you manage your stress, you may prevent your burnout, and even you can manage it easily. That is a bit the fine line between burnout science and mental health science. Thank you.
Thank you so much. Vincent, you want to add something?
Yeah, thank you very much. I think one of the things that our colleagues online need to know is that the common mental health problems really that are likely to play out in the teachers that we will meet are basically anxiety related, and some of them most of the others are really related to the mood disorders like depression, and each of those has a specific category of things that are associated with them that could be helpful for them to really realize how they can seek support. For instance, if they are depressed, they will lose interest in doing the things they had pleasure to do before. They will become extremely the right word is they become extremely I'm losing the right terminology, but they get extreme sadness when they are depressed. They begin to have some kind of losses in concentration. They lose appetite or gain it. Some of them have sleep problems. When it is on the side of the anxiety, they get nervous easily, and they go through a lot of things like panic attacks. But we've also talked about some people with alcohol issues. When alcohol is taken in its extreme, it could also become a problem for them, and then could stir up mental health challenges that may affect their ability to do the work that they do. So again, for alcohol-related symptoms, again, those come with another set of reactions that are really mental health in nature. So I just wanted to put it in a wider context so that we know that, you know, it's not a narrow path, but it's quite broad, and many of the experiences we have in our societies are triggers for it. Yeah.
Okay, thank you so much for that. Colleagues, time is not enough. Allow me to hand over to my colleague Marianne, who is the team leader for the KIX Africa 19 team, to summarize some of the key points so that we can wrap it up nicely. Over to you, Marianne.
Thank you so much, Victoria. Can everyone hear me?
Yes.
Awesome, thank you. So I'll just take a minute to wrap up. I think we have heard a lot today, and the idea that I'm really resonating with right now is that teachers are going through a lot. Teachers are going through so many stressors right now. There's financial stress, as we heard about in Uganda and in so many countries, limited resources in their classrooms, limited control over their deployment and their placement, distance from their families. Some teachers are facing conflict, they're facing violence. We saw that in Ethiopia and Eswatini and many other countries, loss of school buildings, dropout rates for their children. They're facing drought, climate, environmental catastrophes, health crises like HIV/AIDS, like we heard about in Eswatini. And this is all taking place in the ongoing backdrop of the education crisis in so many countries where children are achieving very low outcomes. There's crowded classrooms, low resources, teacher burnout. We know all of the problems. When I listened to everything today, it made me think that it's inspiring and amazing that any young people from our countries still want to become teachers with all of these problems that we are privy to and that we have been discussing today. I think we should reflect that if anybody still wants to become a teacher despite all of this, despite all these challenges, we should respect them for their resilience, for their perseverance, for the passion that they feel for their jobs, for their future of their society, and for the children in their care. But it's not enough just to praise teachers for their perseverance and their resilience. We obviously need to support them through systemic changes, institutional changes. And we heard about so many of those today. We know that teachers, when they are able to do their jobs well and when they feel supported to do their jobs well, they can be an invaluable force of good for their societies. We know the good teachers in our lives, those teachers who seem happy to be there. And we know teachers that struggled to be in the classrooms when we were students. We know that teachers create all other professions. But every human being has needs. We know that in Abraham Maslow's hierarchy of needs, that everybody has complex needs, whether they're a student or a teacher, a parent, a school leader. We all have basic physiological needs, the needs for safety, including financial security, and we have psychological needs. And teachers cannot begin to meet their students' needs until their own needs are met. Teachers are the first line of defense, as someone said in the chat box, in identifying their students' mental health concerns. If we expect so much from our teachers, then what can we do for our teachers? We know that mental health is important, but it's been long stigmatized. And as Philbert and Vincent said from Strong Minds, for too long, mental health was just not praised and valued enough. But it's as important as physical health for our teachers and for our students. We need to be more curious, more concerned about teachers' mental health, and more creative in supporting them. And we need more research on the issues affecting them. There were some calls in the chat box for more research on certain topics that stuck with us today, such as the shocking link that was made between teachers' suicide rates and their salaries. So someone expressed more curiosity in that and called for more research on that. What is the link? What can we learn about that? Is there a way we can study for a couple of years teachers' salary increases in a certain school that's been struggling with this and see if they are showing lower rates of depression and anxiety? And we can be encouraged today by some of the interventions that we heard about. from Ethiopia, Uganda, Eswatini, but also other countries. And from the studies by UNESCO ICBA, UNESCO Rosa, we heard about master training courses. We heard the need to mainstream mental health in teacher education. We also heard about including teachers in more discussions and advocacy work, conducting more research and studies, and something from Strong Minds, determining your spheres of advocacy and control and your spheres of action. What can you do at the communal level, at the school level, and what are you interested in advocating for at the policy level or the wider social level? So I'm leaving today encouraged to identify our various spheres. What do we have control over? What can we be responsible for? What can we take action towards? And what are we interested in seeing over time at the social and at the political level? What do we have control over? So that maybe if we're teachers here today, that may be just our own classroom or even one or two students' lives. Maybe we have control over just a few people. If we're working in a ministry, maybe we have control over thousands of people. So what is our sphere of control and action, and what responsibilities can we take? And I just want to end by reminding us all that UNESCO ICBA's motto is empowering teachers for all learners to thrive. And the goal of, one of the goals and the focus points of GPE KIX, the project that I work for, is teacher professional development. We cannot focus on anything else until we at least meet teachers' most basic needs. We heard about many of them today. Financial remuneration needs to be talked about more. It's part of mental health. We have 2 more webinars coming up in the next couple of weeks we want to remind you about. We have one on September 14th on teachers in crises and emergency contexts, and one on September 21st about the key drivers in teachers' motivation in Africa amidst the changing nature of the profession. Let me just end there. I want to pass it back over to you, Dr. Victoria Kisake Kanobe, and I want to thank Dr. Quinton Woden and Dr. Jerusalem Asmrao for their inputs today, and to all the speakers. Thank you.
Thank you so much, Marianne, and we request that you turn on your videos so that we can take a good picture if you can. And thank you so much, everybody, for being present. Special thanks to our keynote speaker and to all presenters. I've also seen colleagues from UNICEF, the Chief of Education, Wangan. Many thanks for joining us. Colleagues from ADEA, from the Ministries of Education. Thank you so much. So I'll hand over to Gabriel or Marianne to take the group picture if you can. And you can wave as we sign out after the group picture. Over to you, Gabriel. Thank you. Gabriel, are you ready? Okay. I love your smiles, colleagues. Just smile a bit for the group picture. Marianne, you can take one if Gabriel is not ready.
Please unmute
okay.
the switch on.
Okay, over to Marianne. You can tell us, and you can smile. Some of our smiles are conditioned.
Yes. Please keep your cameras on. I'm trying to take pictures, but we have so many people. We have 12 pages. Please keep your cameras on for a minute. Okay, beautiful. Over to you, Victoria.
All right, thanks everybody. I appreciate you, and don't forget to join us for the next webinar on 14th on teachers in emergencies and crisis settings. Over to you. You can wave and say hi. The webinar has ended. Bye-bye.
Goodbye.
Bye.
Bye. What a beautiful session. Bye. See you soon.
Bye. Thank you.
Goodbye.
Bye.
Hello.
Bye.
Bye-bye.
Bye-bye. Bye.
Bye.
Hi, Ruba.
Bye.
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 Oh, hold on.
Alicheka kae. Sijira bye.
Umeniona Olga?
Please, unmute our video. Don't say bye.
Show everyone here.
Bye. Bye.
Bye.
Bye.
Bye.
Bye. Bye.
I miss you.
Bye.
Bye. Bye.
See you.
More than Nigeria. Bye.
Yeah.